I would just like to say thank you very much to VitaFlow for inviting me to come today. It's been a great meeting. I'm sure you all would agree. And the meal last night was wonderful. So thank you very much for putting us all up. I've titled this, When Do We Start and What Do We Say? It's a bit of a reflection of our experience. And thinking on what Wendy said, I think we've got an awful lot of work to do. I would imagine, and I think it would be useful to know, and that could be one of somebody's surveys, as to, what do the rest of the units do about talking to our young people about pregnancy, especially with PKU. In Scotland, we have what we call a curriculum for excellence, and this covers all stages from early preschool years and primary 1 right through to secondary 4. And the children, or the young people, they have, the teachers work through, I don't know, I'll come to this, but they work through a series of I suppose programs and different topics and different subjects come into the curriculum for excellence. So it might be that relationships would come under more than just the one topic. And the topics that they cover in the curriculum for excellence are expressive arts, health and well-being, languages, literacy and English, mathematics, modern languages. So I think with the things like the health and well-being, this might be covered in more than one of these sections, or sort of relationships might be coming to more than one section, because they cover also things like social studies and sciences. This is a bit of a busy side, but I've highlighted the what I think is probably where we might start to think about what we're doing in red. So the early years with relationship advice, they're talking about, excuse me, how you make friends, how you get on with friends, and then that moves on to more serious relationships by the time they get up to secondary 4. And I've highlighted the red, the middle years, which is the second stage, because this is at the end of primary 7. Now, primary 7 is the year that they would move, the year before they move into secondary school. So they're around about 10, 11, and I suppose some of the older ones are nearly at their 12th birthday. And this would seem to us a reasonable time to start, for our young people with PKU, to start introducing the topic of pregnancy, because they're already covering this sort of thing at school. So that would sort of tie in with what they're being taught at school, and maybe this is when we should start to broach this subject with our young people in clinic. The Glasgow experience, we're talking about what we do. I think we introduced the subject of pregnancy and PKU at different stages for patients. And it often depends, I don't think we're very good at this, it often depends if it comes up in conversation. We might start to discuss it with our older young people if the diet is not well controlled, and talk about the need for good control if they're pregnant, or if they want to become pregnant. It's generally discussed, I think, with the parents first, and I think sometimes it's often a topic that comes up shortly after diagnosis, especially if the newborn is a girl. And they might start to talk about the future. We all know that, 10 days after the baby's been diagnosed, they're thinking about their first birthday party. They're thinking about what's going to happen when they go on sleepovers in school. And sometimes I think the topic of pregnancy and PKU might come up then. But that's probably then hidden in a blur of how they're coping with a newborn, and would then get lost as the years goes on. We don't have a set format. We don't really reference anything to education or what's being taught in school. And I think that generally the topic starts to be discussed and introduced when the move to adult services is starting to be discussed with the parent and the young person themselves. And this leads on to the discussion about why it's important to take the diet and pregnancy seriously. And it can be discussed with the consultant and the dietitian. And we've two consultants, Peter Robinson, he's locum now, he's been working with us for a long, long time and has recently retired, and Alison Cousins. And I can sit in clinic with Peter and you can feel the embarrassment in the room. And he's talking about, oh, this is a topic and I feel like a granddad, and everybody's really mortified. So I think the time and the place has to be taken quite seriously, and this is maybe something that we need as a discussion about what works for other people. There was a survey done last year about challenges faced when approaching, from the meeting last year, about the subject of pregnancy and PKU, when we discussed this with patients and their families. Patient receptiveness, being embarrassed to talk about it, patient engagement, all these things. People felt that the young person was too young, too many people in the room, it's maybe inappropriate. But I think also overprotectiveness has got a lot to do with it. And we would love to have clinics where we're trying to teach our young people or to talk to them on their own. But when you've known a baby or a child since they were 10 days old, you've got to know that family really, really well. The assumption is that you'll see them all together. And trying to separate the parent from the child in clinic, I think, is a really challenging thing to do. And this is something that we're going to be trying to work on. I can remember, is it just last week, talking to a 12-year-old with their dad, and his dad saying, there's no way you're going to be seeing my daughter on their own until she's at least 16. And I think trying to deal with that sort of attitude is going to be a real challenge. We maybe would have further discussion with the young person if we were asking if there's a boyfriend on the scene when they're going out clubbing. Do they take alcohol? But again, if there's a parent or somebody else in their room, they're not going to admit to what they're doing. I think we all have patients that we would consider to be at risk. But then again, if they do surprise you, and I think this is boys as well as girls. I can remember one mum coming into the room saying, can I have a word with you on your own? So she came in, she said, I've got something to tell you. And I thought, oh, she's going to tell me she's really ill, she's got breast cancer or something. And then she turned around and said her 15-year-old son was going to be a dad. And, you look at her and you think, he's the last person that I would have expected to have got into that situation. We're really fortunate in Glasgow that we've got a midwife who's assigned to our service. And this is one of the reasons that our clinic, the young people change at 16. At 16, the girls go to our adult clinic. And the reason for 16 is that Cindy can then talk to the girl themselves in confidence. So she will talk to them without letting us know if she feels it's appropriate, what they've discussed. And she will talk about the risks of unplanned pregnancy and safe sex. And that discussion is between the two of them. If she feels that we need to know, then she will let us know with the girls' permission. But 16 is probably a bit late. We have had girls referred to her earlier with the mother's permission, or with the mother has felt herself that Cindy needs to see them. So as I say, they're referred from the age of 16. It felt appropriate to transfer at that age, but we don't transfer all of the girls at that age. Sometimes we might keep them longer if we have any concerns about them. We've got this specialist midwife, and Cindy's able to have confidential consultations. We really try to emphasize the need to get in touch with us as quickly as possible if they're thought to be pregnant. And we would hope that they would always do that. We have had a girl that came to us from another clinic who had told her friend at a youth club that she thought she was pregnant. She was overheard by one of the staff, and by then it was really too late. And that's what we want to try and prevent. So we want to be able to engage the young people as much as possible and keep on their side so that we're not distancing them from our clinic, so that they feel that they can phone us up at any point and say, look, I think I'm pregnant, or I think I've got a problem. Our setting is not ideal for the adolescent girls. The only clinic room we have at the moment is mixed in with the antenatal and gynae clinics. So a 16-year-old girl just transferred from pediatric clinic sitting with a whole load of women who are pregnant is not ideal. Excuse me. However, the staff are familiar. We're all on the same site as the pediatric clinic, so consultants the same, and the dietitians, we both share cover for the clinic, so at least the clinic staff are the same. And as I say, we get cross cover. At the moment, we've got a male consultant and we've got Alison, and Alison is not covering the adult clinic as yet. And we've got our understanding. So we're in the process of changing that because we recognize it's not ideal for the young girls, but trying to change clinic times, clinic days is a long, slow process for us. And changing people's times that they're available is also quite a challenge. So what's next? I don't think we do this very well in Glasgow. I think we could do an awful lot better. We've probably got the same unplanned pregnancy rates as everybody else. Cindy tells us that unplanned pregnancies account for 50% of live births. It is a tragedy when somebody becomes pregnant and then opts for a termination. I think that's just something that upsets all of us. But I would hope that following from the meeting, then we could come to maybe some agreement about how we're going to move forward. We need to develop resources for us to use. And as Wendy's pointed out, third down on the list is health professionals. And I think that's something that we should take and move forward with. So it would be good to be able to develop guidelines or suggestions of how to introduce the subject of pregnancy and PKU with our young people. Maybe we do need a survey of the knowledge of parents and adolescent girls with regard to PKU and pregnancy, and that would maybe be a starting point. And what might be good then is web-based information for parents and adolescents to be able to access at any point to back up maybe what we're talking in clinic. Thank you.